Taking this just a little bit further, and this is more forward thinking, are there data points or patient details that you think the pharmacy can document so that health plans and pharmacies can further collaborate to improve patient, or in the health plan's case, member outcomes?
I think it would be incredible if pharmacists can document the blood pressure of the member, the blood sugar levels of the member. I think the provider would love to see that information as well. So those two things are key. And if they can do point of care testing for LDL and triglycerides, those are key information that the providers as well as the health plan would benefit from knowing.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
All right, so welcome everyone to the Pharmacy Quality Solutions Show. Hi everybody, my name is Kerri Musselman and I'm going to be moderating today with Bahar Davidoff. We'll go through introductions here in a little bit. Welcome to our PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, and on today's episode, we wanted to highlight that November is National Diabetes Month, and that over 38 million Americans are living with diabetes. It's a condition that demands constant management, and the success of that management doesn't just rest on the patient, it's a team effort. Today, we are zeroing in on two major players in the healthcare ecosystem whose coordinated efforts are absolutely critical in driving better patient outcomes: health plans and pharmacies. These organizations are on the front lines, managing everything from medication cost and coverage to patient education and adherence. So, how exactly can health plans and pharmacies work together this month and every month to move the needle on key metrics like A1C control and medication adherence? We'll be discussing the shift to clinical value, incentives to pharmacies, and the future provider role. Stay with us as we unpack the critical role of these partnerships in the fight against diabetes. I would love to introduce our panelist today, Bahar. Bahar is the Vice President of Pharmacy with SCAN. Welcome to the show, Bahar.
Hello, thank you so much for having me. I'm really excited to be here.
That's great. How are you doing today?
Great, thank you.
Can you provide our group and our users some additional information about your background?
Definitely. I'm a pharmacist by training. I started in retail at Rite Aid and then moved on to hospital and later to medical group. And I was there with the medical group for 12 years. There, I worked very closely with our executives to build clinical programs through collaborative practice agreements for our pharmacists. And then about a year ago, I joined SCAN because I felt that it was at the health plan that I could really make a difference in pharmacy. And so I'm really excited to be with SCAN Health Plan. We're a nonprofit organization, a local plan. And so the majority of our members use independent pharmacies. And because of that, we have partnered very closely with independent pharmacies and are looking forward to innovating in that space.
Well, we are very excited to have you, and I'd love to be able to get your perspective on all of your background for our diabetes podcast. So thank you. So whenever we're ready, we'll go ahead and go to the first question. So first, talking about the shift to clinical value. For community pharmacy that has historically relied on prescription dispensing revenue, what are the 2 to 3 most critical operational and cultural changes that need to implement now to effectively transition to a successful clinical service model? What are your thoughts?
So I'm really excited because now is a great time to do this. And to your point, there's multiple shifts that need to happen to allow independent pharmacies to be able to have pharmacists practice at the top of their license, especially as we're talking about diabetes, for example. We know that our members are coming into the pharmacy multiple times a year, if not every month. And I think that they can definitely make a concerted effort to not just dispense the medications, but actually provide clinical value to them. And so the first shift that needs to happen is to go from the dispensing to providing value, which is the quality of the interventions that the pharmacist can make with A1C, diabetic foot checks, reminding our members, their patients, to do eye exams annually, and being mindful of the effect the medications are having on providing good health outcomes for our members. So I think that's the first one. And then second, I think we need to change the workflow in the pharmacy. And so, for example, now we're working very closely with the USC School of Pharmacy to enhance what technicians can do to be able to support pharmacists to provide better clinical care. And so that would be blood pressure, A1C, cholesterol, starting out with a comprehensive medication management to do a medication reconciliation. We actually are even working with pharmacists now to do a post-hospital discharge medication reconciliation. So we're hoping to provide them the list of medications that our members were on before they went to the hospital, the list that they were on during the hospitalizations, and then for the pharmacist to reconcile that and provide their recommendations to the primary care physician at the post-hospital discharge appointment, which is supposed to happen within 30 days. And as you know, that's a quality measure. So there's a lot of opportunity for us to enhance what pharmacists can do. And then lastly, they need to get reimbursed for their services. So how can we do that? That would be through medical billing, probably, point of care testing. And there's a lot of states that have test to treat for strep, COVID, flu. But I think we can enhance all of that by supporting the pharmacist and getting the billing. They can get reimbursement for their services.
Well, thank you. I'm going to lean into a couple of the things that you just mentioned. So the first one, you had mentioned that patients or members go to their pharmacy often. So how do you recommend or looking at the maximum touch points that patients see in the community setting?
We can leverage those touch points to remind diabetic members to do their A1C testing so that they can discuss it with their primary care physician if the medication needs to have dose adjustments. And I think pharmacists are definitely positioned well to be able to do that for the members and let them know that we can make regimen modifications, dose modifications to reach your goal for your A1C.
Perfect. Thank you. And one of the second item that you mentioned was the change in workflow. So what are some of the areas that you would recommend for folks as we start looking at pharmacists and pharmacies needing to change how they work through their workflow to be able to integrate these types of clinical services?
So obviously, pharmacies have to make sure that they have a workflow that allows them to dispense medication. But I think there needs to be an evaluation of how do you allow technicians to be able to do more so that the pharmacist can be less involved in the dispensing and more on the clinical side. And so that is really important. And we're trying really hard to provide education for technicians as well as certification so that they can do more in the pharmacy to allow the pharmacists to do more clinical work.
Hence the partnership that you guys have with the college to be able to do the training.
Exactly.
All right. Perfect. So now that we've talked about the shift to clinical value, we're going to transition a little bit to one of the third points that Bahar mentioned, which is the reimbursement or payment. So looking at incentives and risk sharing. So pharmacy, like the rest of the healthcare world, continues to evolve beyond the fee-for-service payment for individuals regarding clinical encounters. How can health plans design value-based shared savings models that directly tie to a pharmacy's reimbursement to achieving specific measurable improvement in patient health outcomes?
So one of the things that you pointed out is value-based payment equals health outcomes. And so if we are able to track and monitor, if a pharmacy is able to track and monitor what the outcomes of the member is in terms of their cholesterol, their blood pressure, their A1C, then they will be able to get paid for those outcomes. And so we need to partner with platforms that allow pharmacists to have access to the information they need for the labs, for example, or even prescribe the lab to so that the member can go to the lab and the pharmacist gets the information so they can make dose modifications and regimen modifications.
Okay. So given that this is the diabetes month for November, what are your thoughts on designing a plan that has improvement of outcomes specifically for diabetes, such as A1C control? You mentioned the robust plan you guys have for reducing hospitalizations within the population that you guys serve.
One of the most important issues that we need to address with members who have diabetes is adherence. We see that adherence is definitely a problem that can be addressed by the pharmacist, and maybe that's through addressing side effects or that there is a lack of knowledge about the importance of adherence. So I think that's where a pharmacist can definitely make a difference. The other one is avoiding high cost complications. So whether that's ER visits or readmissions, we know that there is admissions due to DKA, hypoglycemia. And so the more education that the pharmacist can provide to their patients regarding the medications that they're on, the importance of adherence, and the education about the outcomes of their A1C and what it translates to for them for their health outcomes, not just within a few years, but even further, where we can discuss what are the ramifications on their vision or their kidney, which can lead to dialysis if untreated, and even amputations from not doing the routine foot exams. So it's very important that pharmacists see themselves as clinicians that can make a huge difference in our patients with diabetes.
Okay. Thank you. Summed that up pretty well when we start looking at the value-based clinical programs and where pharmacy can kind of lean in. So moving into when we start looking at continuous care, the pharmacy team engages with patients more often than the provider, as we talked about a little bit earlier. And when we look at value-based care and health outcomes, we are often measuring outcomes over a longer period of time. We know that over a period of time, the patient behavior and situations do change. As long as pharmacy transitions from a practice of filling prescriptions to continuous patient monitoring and feedback, what details should pharmacy team members review with their patients as they're filling their medication, especially the adherence?
I think they should review what medications they're on, They should review how to test their blood sugar, the importance of testing, how to keep track of their blood sugar levels, and then how to make modifications if they have a reading that's higher than expected or lower than expected. And also all of the other preventative measures that members need to do for keeping healthy. I think pharmacists can even discuss or should discuss the lifestyle modifications as it pertains to their medications.
Taking this just a little bit further, and this is more forward thinking, are there data points or patient details that you think the pharmacy can document so that health plans and pharmacies can further collaborate to improve patient, or in the health plan's case, member outcomes?
I think it would be incredible if pharmacists can document the blood pressure of the member, the blood sugar levels of the member. I think the provider would love to see that information as well. So those two things are key. And if they can do point of care testing for LDL and triglycerides, those are key information that the providers as well as the health plan would benefit from knowing.
All right. Well, thank you so much, Bahar, for the conversation today. So just kind of as a recap, as we start looking at the Diabetes Awareness Month, utilizing pharmacies and health plans as a partner in medication adherence, clinical monitoring type programs such as blood pressure and A1C, working through and checking A1Cs, blood pressures, and or cholesterol levels at the pharmacy using point of care testing, and then being able to uniquely shape pharmacies in a value-based care payment model with risk tiering options to improve health outcomes. Clinical monitoring, the clinical outcomes, as well as reduction of readmissions, and using pharmacy to assist with the discharge reconciliation. Anything else that I missed today that we covered that was pretty high level?
One of the things that I think I didn't touch on that is very important is we can leverage those connection points with the pharmacist to also address social determinants of health. So if there's access issues to the pharmacy, to the medication due to cost, if there is lack of education, I think all of those are things that pharmacists can also address and would make a big difference in the members' health outcomes.
So true. Pharmacy is well positioned to be able to take a look at the patient's understanding, because how many times have they gone to a counter and they say, oh, I can't afford this. And so you're having to work through on the back end to help them figure that out. Great call out. Thank you so much. All right. Well, thank you everybody for listening to our show today. It's been a pleasure having you, Bahar, join us and answer some questions. So we want to thank you for joining us. We hope you listen to the next episode of the Quality Corner Show. And before you go, we have one final message from the PQS team.
It was my pleasure to be here. Thank you so much for having me today.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes. And we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.